send, you see. So those, as a parent, those are the key things that you're supposed to look at. So when you see your child behavior is changing all of a sudden, you have to observe really well. And then the other thing is physical symptoms. So you can check the eyes. So the eyes, they're always like in red in color. When you use alcohol, when you smoke tobacco, you see that your eyes will start turning red. And then there is when your pupil is dilated. So you see, those are the small things you should observe. Also, severe or a fast weight loss. That can actually be an assurance of someone abusing a certain drug. And then another one, another sign that you can use, number 3 is neglecting responsibility. So in neglecting responsibility, you find out that maybe a father, right? A father has been so hardworking, he wakes up early in the morning around 4, he goes to work, and by the time he comes back in the evening, he has brought all the necessities in the house. But all of a sudden, he starts coming home drunk. When you ask for money, for maybe supper or lunch, he beats you up. There's some cases, a lot of cases, which we've had from social media, from the news, our daily news that we see on television about these cases. So that is a ways you can see that someone is abusing a drug. So like example, my uncle back in the rural areas. So he was addicted to these traditional brews. Mostly he was using the chana. I don't know if you've heard about chana.
Yeah, it's being abused where the community unit where I was educated, I see that there is a mama selling the chana.
Yeah, these things are not supposed to be sold to people because they are really unhygienic. The way they make it, it's unhygienic. So it's really illegal for someone to make chana. But so my uncle back in the rural area, I'm from Western, so he was totally addicted to this traditional chana. So you'll find that he was a very hardworking man, but he actually stopped work because of drinking chana. Number 2, he started selling things, small things like sufuria, to just get a cup of chana, the children's clothes. The children actually ended up walking with torn clothes because the father is sold. You see, that is very sad. That's when you see a case of neglection when you're using drug abuse. But at the end of the day, I can see my CHV is laughing there. It's a true story. Yeah, it's a true story. So at the end of the day, we took him to a rehabilitation center and he was helped. So we'll talk about how the strategies we can input as CHVs at the end of this session. And now he's actually a pastor, so you see.
Wow.
So another sign is the neglecting hygiene. Hygiene, that is self-explanatory. Someone just starts becoming dirty, they smell, yeah, things like that. Financial problem because most of the money is taken to buying alcohol, so anything that he thinks of is just drugs, not food, and you'll find out that even the health will deteriorate. And then we are going to go to the risk factors of drug abuse. Number 1, we have peer pressure, like the youths in Soweto. That I can tell you for a fact that was peer pressure. That's why we received a total of, when we're putting it into percentage, we would find that 72% of the youths in Soweto were actually take one of the drugs that I talked about previously. So you can see that it has really affected because of peer pressure. When your friend just tells you, let's go and try this, we are now grown ups, we are now adolescents, let's go and try these things. And you don't want to be judged, obviously you will go there, right? And then the other thing that is a risk factor is stress. Some people, they take bang or alcohol as stress relievers. So you find out that when maybe if a man doesn't have a job and employment, he will actually go to the bar to take alcohol because he wants to regulate his stress. You see, but that is not good because it will lead to addiction. Another one is genetic. Genetic also, when link it to the environment or even the environment that you live in. So genetic, when maybe one of your family members was suffering from this addiction, you can find out that someone behind is likely to inherit that habit. So it is well as CHVs, when you see a problem like that, it's better for you to intervene very quick before it goes out of hand. So you just go to the person who is highly risk for getting to addiction. You talk to them and you try to manage them. And then the other risk factor is social media. Right, right now we are living in a digital world where our youths have access to all social media platforms. So in those social media platforms, you find that they have posted these types of drugs, and due to curiosity, they would really want to try. They'll be like, why are those people trying and I'm not trying? So they will make an effort to try. So these are the things that push most youth to abuse the drugs. So I'm going to, have you understood up to there? Any question? Before I move on to the next objective? Okay, thank you. I can see that you are getting along. So the next thing that I'm going to talk about is the health risk factors associated with drug and substance abuse. The first one is addiction, what we talked about. And then the second one is mental health illness, because some of these drugs affect the mental health of an individual. So the mental health that is contributed by drug abuse is number one, depression. Because you'll find out that if a person doesn't have, they don't get these drugs, they will fall into depression because they are already addicted to them. And then they'll also be affected with different mental health disorders. And then another point is physical health problems. So you can find the person will suffer from liver problem, especially if you take alcohol, you are likely to suffer from liver cirrhosis. If you take tobacco, I give you tobacco there, you'll have lung cancer or heart diseases because of smoking. We have the active and the passive smoker, right? We are all affected, you can see. Yeah. Another one, accident and injuries. Obviously, there are some people, especially the youths, this thing is affecting youths. They are so ignorant. On TV, you've seen adverts that talk about do not drink and drive. But you'll find a youth, after coming from partying and everything, they just decide to drive, and they drive with friends. So you can see the risk that they're putting themselves into. So when we put down strategies to stop this drug abuse, I'm sure our nation is going to grow to a better nation. And then the other one, it can lead to the spread of diseases, like it's actually the biggest health factor that is linked to drug and substance abuse. Number one, it will lead to a high rise of HIV cases and STI spreading. Because when someone is already deep into drugs, right? They are at high risk of contracting HIV and AIDS, because right? When they are under the influence of alcohol, they make decisions unknowingly. So you just find someone, they go and they engage in sexual activities without using condom, without, things like that. So they might lead to the spread of HIV and STIs, and also it can lead to early pregnancies. So that is also the thing we are as a CHV, we are against early pregnancies, right? So other risk factors are crime, apart from the health factors that are affected by the drug abuse, is number one, crime. Number one, crime. There's you'll find that many youths will result into crime to get money, to buy the drugs. Another one is violence. I talked about the effect of violence, right? And then the other one is neglection of responsibilities. So we are going to go to the last objective for today. That is the prevention and the strategies we can put across as CHVs of different units. You know, it's better for us to come together, learn about these strategies, and our nation and our units will go.